So good afternoon, everyone. Welcome to the first DHCW Digital Governance and Safety Committee of a new financial year. We have a busy agenda this afternoon, and in the interest of time, I'm going to ask everyone to introduce themselves when they come to present, or when I call on you for a question or to make a comment. It's also my honour to welcome our CEO today, who's observing. So great to have you, Helen. Delighted that you could be here today. I'm sure the committee will behave in the usual very high standard, open and constructive way that they always do. So, Helen, you're very welcome, and I hope you keep standards up. And And Darren, I think you've also invited some colleagues today. So Marcus Sandberg and Dave Parsons, who has been involved in producing the WASPI. It's not quite yet a code of conduct, but we'll get onto that later. Not a code of conduct yet, is it? But
No, not
that might be in our future. That might be in our future, and we'll discuss that later on. I'm also going to take the opportunity to mention that Andy Warburton, who's presenting later on this afternoon, the Information Services Assurance Report on behalf of Rachel, who's not able to attend today's meeting. So, Andrew, you're very welcome as well. Look forward to that. And so Rachel's absent. Oh, my pleasure. And then Rachel's absence brings me on to noting that our fellow IM Marilyn Bryan Jones is not with us today for very good reasons, and Carwyn Lloyd Jones is also unable to attend today, and Evan Evans will only be attending part of the meeting. And out of the corner of my eye, we've now been joined by Rydian, so that's brilliant. We're all here. And Rydian, I hope that you had an excellent presentation just before lunch. I know you were rounding out a morning's presentation with Westminster, talking about our plans in digital health in Wales. So I hope you've had enough of a break to be able to be present here. Okay, so with that in mind, usual structure of the committee today. There will be a private session at the end of today's committee where we'll spend some time discussing some of the private risks that's just not appropriate to discuss in the public domain. But in the interest of openness, we will always present a summary of those discussions as far as we're able to in the next at the next committee. All of the committee papers and the minutes for this committee are available on the DHCW website. So if you are watching a recording, or you'll be able to find those materials to run alongside. And then I'm aiming for a 10 to 15 minute comfort break in today's committee, which we'll aim to do at item 3.5. If we need one earlier, just put a message in the chat window, and we'll be flexible, I'm sure. I'm going to beg that you are all a little forgiving of me today. I'm not at my usual setup, and so I'm working on a very small laptop screen, which means that I might not always be looking in the camera, and that applies to all of us. We've got committee papers that we'll be referring to throughout. So if I'm a little awry, Chris, can I task you with just interrupting me and giving me a prompt as necessary? And then we should bring this meeting to an end by about 3:45 today, so that we can have a small break before beginning our private session at 4 o'clock. Okay, so hopefully that's all clear. Has anyone got any questions? And if not, I'll move on to declarations of interest. So if you've attended the subcommittee before, you'll be aware that we have a general declaration of interest that I make. I'm a founder and shareholder in a company called Precision Life. We do analyse healthcare information in a secondary use context, and there is an arrangement that we will hand the chair over to David Selway if there are any matters for discussion that might overlap with that. And with that in mind, today I have made Chris and David aware that we will be handing the chair over to David for matters relating to the NHS secure data environment, and also the section on the need for a SNOMED-like allergy system to support some of our digital medicines portfolio. The reason for that is I have been working with industry organisations, lobbying with government on the NHS SDE plans as they relate to companies wanting to use that information for secondary use, which is not the core purpose of the SDE. The SDE is there for use of secure information, so I think that's very important that we say that. And Precision Life founders have worked in ontologies for decades and have published on building, managing structured information. So that's why that's the case. But even so, I will participate in the conversation in those sections. Is just be aware that I have that potential interest in that area. But should we have any decision to make, I would not be party to that decision. That's all up to you. And with my NHS DHCW hat on, I would fully support any decision you make. Okay, so with that about me, do we have any other matters arising that we need to bring to the committee and either say now or add to the agenda? I can see shaking heads at the bottom of my screen. Good. Okay, let's get on. Okay, so moving to the consent agenda, I haven't been notified that anyone has had any comments on the consent agenda. So the minutes of the last meeting are for approval unless anybody has something to add now. I did see something flash up on my screen there. Okay, so I think we can take that as approved. And you've also seen the forward work plan. We've got a lot to do. So I think we can all take that as noted. And in which case, Chris, I'm going to invite you to lead off the main body of the meeting today by bringing forward the action log.
Yeah, thanks, Chair. So there were just two actions from the last public board meeting. One related to the data promise, which Darren has included. It's on the main agenda today, so we'll cover it later on. Thanks, Darren. And the second one came about from the digital programme overview update that David Sheard gave last time around the NDR and that coming back. It's not on the agenda today, Chair, but I'm happy to work with Ivan and Rebecca should you and David want that on the agenda for the next meeting in August. We will mention this in the context of the switching service, and you'll both be aware of the risk mitigation relating to the NDR and the role that plays there. So I'll pause because I can see David's got his hand up.
David?
Yeah, thanks, Chair. Thanks, Chris. Just on the NDR benefits timeline, there was a meeting on the 4th, which has just gone. Is there any update from that you can share with us?
Yeah, so there was an exec strategic session that took place last week on the NDR. It's probably fair to say, David, there was a good discussion, but there is more work to be done, and there's liaison we're doing with Welsh Government at the moment. So part of the reason I suggest it comes back to the August meeting, I think some of that discussion and conversation would have been had, and we'll probably be in a better place to update on the benefits piece.
Okay, great. Thanks, Chris.
Yes, Chris, I'd certainly support it coming back in August. It's a key project for us, and I think we need to provide, have some level of a line of sight to the programme. So look forward to that being on the agenda in August. Okay, so I think, Chris, if I can ask you to move on to the corporate risk register. Yeah. And give us the briefing or the citing so that we can move into a conversation on the risks.
Yeah, thanks, Chair. So I'm going to run through some of the changes since the committee last met, and then we'll go through. We have scheduled a deep dive into one of the risks that the committee haven't had a deep dive on. So that's where we're hoping to focus some time and opportunity for discussion. So there are, when the report was produced, there were 31 risks on the corporate risk register. That has gone up slightly since, but I'm going to work from the date this was published. So 20 of those are assigned to this committee, 10 of which are public risks, so those within the papers today. We will be considering the other 10 in the private session, which will follow this, and there's a few in the private session that we will also have a bit of conversation around some of the new risks. So in terms of changes since the last meeting, I want to make committee members aware there have been 15 new risks that have come onto the risk register, 11 of those public, 4 private. The table under section 3.4 in the papers highlights where those risks relate to this committee and where they relate to the Audit and Assurance Committee. Committee members will be aware from previous discussions. I think the last meeting we talked about the internal audit report into the switching service. So that risk has been split into 3, and that's captured within that table. There's been changes to the risk score for 2 risks, one of which is assigned to this committee, 0299, supply capacity to support electronic prescription services readiness activities. It's a bit of a mouthful, but that risk has increased since the last meeting. I do want to make committee members aware that is likely to decrease in the next few weeks. There's a programme board meeting on the 18th of May, but the indication I've had from Ivan Evans, who's the exec lead for that risk, is that he expects that to decrease in terms of risk score, but it has gone up since the last meeting. It should then go down. There's been 7 risks that have been removed from the risk register. I'm just going to specifically highlight 2 relating to this committee. The fault domains risks 0228, and there is another private risk, but that will be taken in the private session of the meeting. A couple of other changes which have happened since publishing this report. So the risk 0237, the new resources impact on plan, it's still on the corporate risk register, but it's dropped in risk score slightly from a score of 16 to 12. You'll recall that risk was one of the long-standing risks that we've had on when we did our deep dive analysis of some of our risks that have been long-standing. A few other areas, the data promise 0264, I'm not going to cover this now. I know Darren's got a report on this and it covers the risk and a proposed new approach, so I think we'll cover that for that agenda item. Likewise, the switching service, I know Andy will probably cover that as part of the information services report, and I think the NDR update that the committee will aim to receive in August will also cover that one. So Chair, if you're happy, I wanted to move on to 0296, the allergies adverse reaction single source deep dive. There's a deep dive template that's been included within papers, and just invite Darren to run through that, and no doubt Ridian will want to come in for comment on that one too.
And before you do that, can I hand the chair position over to David, as for reasons we discussed earlier? Okay,
thanks, Rowan. Happy to pick that up. Chris, before we do that, I did have a question actually on one of the risks, 299, the EPS one. And I noted what you said about the increase in score and it likely to come back down. If I understand it correctly, it's to do with the fact that we were pursuing section 255 approval, which I would have thought was known about. So I was just puzzled as to, having got that, why the score then went up if we knew about it beforehand.
Yeah, I think that the reason for the mitigation was around resources within NHS England, and I think the assurance.
Okay.
So I think we've had assurances that those resources are in place, so the likelihood has gone down.
Fine. That explains the context. Okay, thanks. Okay, if we could press on with the deep dive, then thank you.
UK, if I come in there, Chair, in terms of just describing the situation.
Yes, please.
I'm Darren Lloyd, I'm the Associate Director for Information Governance and Patient Safety. I will take the patient safety element of my responsibilities on under this particular risk. Just to give you a little bit of context and background, as part of our robust assurance process, then we have a number of different checkpoints. Two of those are one of information governance, the other one is patient safety. As part of that patient safety assurance, then we go through a series of standardized approaches to try and define if there are any hazards associated with the design and the implementation of any products and services, or the procurement of any products and services that are then made available wider into the NHS and source of care services. Part of that process is to define some of those hazards that may be incumbent on operation of those systems. That part of that process is we work through some of those issues as part of that implementation or part of that design methodology. So it's a very, very important process, because what we want to ensure is that those products and services that are out there are as safe as they can be. Part of the analysis is sometimes around where we are using sources of reference or sources of data that aren't consistent. So what we've had in terms of our risk profile within our organization is from a patient safety perspective, we've highlighted certain risks in our products, small risks in many circumstances where there is an inconsistent approach to actually defining how we operate that system. Now, obviously, DHCW has a context of trying to create a single patient record. Okay. So the context of that is trying to create as also single sources of the truth as we define it. So as we look at the risks across our large portfolio of responsibilities and systems and services, it's about how we then look at the risks on certain aspects of sources of data. So this risk is about allergies and other adverse reactions as a single source. So what we've done as part of the patient safety is highlight across a number of systems where we are doing things slightly different, where it would be incumbent on us or incumbent on the service to understand if there's one approach. So this risk has been highlighted on the back of the fact that we've had a number of different risks that we try to bring together in a corporate way that allows us to observe that there may be things that we can do to mitigate it in a more strategic way to actually reduce the opportunity for misinterpretation of data or misinterpretation of the functionality within those systems. So the adverse and reactions and single source is about trying to achieve, like we have with other systems and services, one port of call in effect for that information and for that data. And sometimes as well, we describe those things differently as well. So the nomenclature, as we call it, or the naming convention of things aren't always consistent. So when a health professional comes across a number of different systems, there may not be any consistency, a great deal of consistency. So that's really important to understand. So basically, this risk is about what we can do as an organization to improve on a situation where we can achieve a single source of the truth in effect. And we've been really successful on that in a number of different phases previously, hence why we have the Welsh Results Reporting Service, Welsh Care Record Service, Welsh Demographic Service, and I could go on basically. So this is about what can we do in order to mitigate that risk associated with this particular aspect of data. So right. That's kind of just the prelude.
Yeah, there's a really good summary, Darren, and I understood that's spot on. We do have a couple of questions. I have one I'll come back to if Rydian or Rowan don't ask it for me. Rydian, you've got your hand up.
It was just to inform the committee, David, that I hope you can hear me, that there are a number of ways that we're mitigating this risk. One of which is taking out entries that are in the PAS process. PAS is an administrative process. It's not a clinical digital system. We've developed and delivered what we call the red box, which is visible within the patient banner at all times when patients are surfing our extensive records on the whole population. And also within that, we've SNOMED coded the way that we record it and improved the granularity as to is someone truly allergic to something. So the classic one, David, of course, is I think I'm allergic to penicillin. Oh, why? Oh, it gave me tummy ache. Well, actually, penicillin can save your life if you have tummy ache. But if penicillin gives you a rash and anaphylaxis, it can kill you. And so who recorded it and what the thing was is one way that we mitigate the risk. But it's a shared and collective responsibility across those who are prescribing and dispensing medication.
Thanks for additional clarification, Rydian. Rowan.
Yeah, and just to say that this is an opportunity to increase, you know, the quality of care and protect our patients. So this is about the sort of prudent healthcare that Rydian has spoken about in the past, and you know, it's a very because this information is recorded by different people in different systems, it's obviously drawn together, and then there's also publications and literature to draw upon, and all of that needs to be pulled together as consistent in a consistent place and be made available to other systems to drive things. So it's not a trivial thing to do, but the value of doing it is incredibly high. So I think that's all I really wanted to add at this point.
Great, thanks, Rowan. Thanks for the additional information. Darren, I did only have one small point. So I read through the paper, really good. Highlighted the progress that we've made in terms of mitigating this action. Towards the end, it does highlight next steps, and the title above that says "and timeframe for completion," and we haven't quite included the timeframe for the next step. So if we're going to update the deep dive, it will be worth adding that in, just so we've got an idea of when the next step would likely be completed.
Okay. David, just to say there's a number of moving parts of this as well, in terms of the fact that we've already done quite a lot in terms of some of that mitigation. Again, where DHCW's responsibilities land is around setting standards as well in certain circumstances. So things like data standards. There is a data standard that has come out in respect of medicines, allergies and intolerances, and the interoperability of systems, trying to then inform the service as well as ourselves internally as to when we procure, design, or we make a significant change in a system, that we take into account that need for that interoperability, and that ability to do that together with of course is our ability to try and spin up another repository that will allow for that consistent approach, and we've defined that as a kind of clinical data engine that allows that consistent approach. So that is one. They are quite large bodies of work which will help to fully mitigate this particular risk then.
Okay, thanks for the additional clarification. Okay, so we'll move on now to 3.3, incident review and organizational learning, and at this point I'll hand back to Rowan.
Thank you, David, for that piece. So if I can ask Keith to lead us through the incident review and organizational learning report.
Thanks very much,
please.
Chair. Thank you, Chair. So I'm Keith Reeves, for Service Management Team Manager, but also Deputy Chair of Incident Review and Learning Group. So what's being presented today is the IRLG annual report. We're in year 2, or this covers year 2 of the group being in existence. And the way that we were setting this group up, there was always sort of a plan for a 3-stage approach. So the first stage, so year 1, was effectively, let's get the group off the ground. Let's look at the general principles that we're going to be following. For year 2, so for last financial year, it was more about the sort of development and improvement of the review and learning frameworks that we're going to be using, but also starting to look at some of the lessons learned and putting some improvements in place in key areas that we felt within the organisation just needed some improvement. And stage 3, which is for this financial year and moving forward, is more about embedding the culture of learning and improvement across the organisation, taking into consideration the sort of strategic missions within DHCW, and also some of the new sort of legislation that's coming in place, things around duty of candour, duty of quality. The report itself, I'll go through section by section just with some of the highlights. It's broken into 4 areas, which are sort of the 4 key principles of the group itself. So the first section, which is around reporting, so this is around the reporting to Welsh Government and to other statutory bodies, sort of the early warning notifications or the reportable incidents. Overall, we've reported 9 incidents, including 2 complaints. One of those complaints was subsequently withdrawn, and these have all been sort of investigated and reports have been brought through the group. Pleased to say that generally the timescales that have been applied as part of the processes have all been met throughout. Where they wouldn't have done, as I've brought to previous ones, then we would work on a red, amber, green status. For the review, this incorporates those which have been reported, but also the sort of what I want to call the non-reportable incidents. So these are typically the technical reviews, the major IT incidents that DHCW experiences. As we went through the year, we also started to look at common themes, and also taking into consideration things like the Yorkshire Contributory Factors Framework, which, as an improvement for review, we then adapted to be able to suit a digital organisation. So as we went through the year, we started to look at some of the common factors, some of the common themes, and break down into individual domains where those factors sort of fell. Because this was a new framework that we were trying to implement, I've done a sort of retrospective review for year 1, and although the numbers have increased, it's more because we've been able to identify them a lot easier as we've embedded it. So there are increases across a lot of the domains, and within the report there's a breakdown of those. The benefit of doing it this way means that what we can do as an organisation is we can look at individual domains and we can go, okay, well, where's the learning? What improvements can we make? So things like the active failures, or what we're calling active failures, which are around the human error type incidents. We can then look at it and go, okay, well, is it because of training? Do they need training up on process? Do they need training up on the use of the technology? Then we can put an improvement plan in place around that, which then leads on to section 3, which is about the learning. So every review we do, there are a number of recommendations that are made. Those recommendations are then logged on the quality improvement action list, and they're essentially actions for areas within the organisation to take forward. So we make those recommendations, but then we can start again to look at the themes of those. So again, if there's a recommendation that we need to deliver training on change management, as soon as we start to see through multiple reviews that we need to do more training on change management, or we need to change the process, or it doesn't work for some areas, it does, then we can actually start to look at the improvement and what the improvement means. So for last year, we There were a number of smaller improvements, but throughout the incident review and learning group, we've identified sort of 6 areas where we thought that they would be good candidates to take forward. So the first one is actually about how we manage our major IT incidents. We have a structure in place which is based around bronze, silver, gold. And so what we've done is we've looked at the effectiveness of that response structure and some of the underlying processes. So some of the improvements we've implemented, we've started on an overview or an awareness training for that what we call management on call. At the last meeting, I said that there would be there's a target of 75% of everybody that's involved within that process. I hit 78%, so I'm very, very, very pleased with that. Some of the other improvements we made, we've reviewed role profiles so that people that are on bronze, silver, and gold know what their role is. And also we've looked at the action cards so that if you've got a new person coming onto the rota, they have a set sort of structure that they can then start to follow. Worked heavily within the service desk area to also look at communications, because within major incidents, communications is very, very key. The service desk have been putting improvements in place around that. And then we're starting to look at the general resourcing and ensure that we've got appropriate staffing levels. And towards the end of the year, we did look to increase the level within the silver structure. Planned improvements for 23-24. So we'll carry on with the management on call so that everybody has at least a level of overview training. We're also looking at the resourcing and the role profiles for other areas which are involved within that structure. And also looking and working with a number of areas within DHCW about the delivery of more focused competency training. So more focused training around incident management or crisis communications. The next improvement was actually around the communications bit. I have talked about this around the service desk. So the service desk have put improvements in place around having defined statements, having a standard format for that, simplifying the process so that there's less running around trying to get sign off before we issue the comms, because we found that was one area of significant delay. Also looking at the communications themselves and going for a less technical approach and making it more accessible to an audience so that they understand that yes, the system is down. They don't necessarily need to know all of the detail behind it. And for this year, it's greater engagement with our communications team, something that we've started off already, but also bring the communications team into the on-call structure. Funnily enough, the incident review, I've talked about the Yorkshire contributory factors. That has been quite significant in providing us with a lot of analysis, so that, and this is where we will push forward with this year to further develop that to make sure that it remains current, but then also taking the findings from that framework and the analysis that we do around the incidents to drive that improvement forward, to drive the learning from it. We also identified change management as a cause of pain, and we had a number of repeat incidents that we were looking at for where changes had been made, but the deviation from the process meant that changes weren't applied effectively. So within the DHCW CAB, so the Change Advisory Board, they are now reviewing those and identifying further lessons learned. And the plan for this year is the ongoing monitoring, the ongoing effectiveness of that. Improvement 5, so this is around workforce behaviours and the review of DHCW values and the implementation of those values. And for this year, what we're going to be doing is we're going to be reviewing how effective that has been, and that'll be through the staff survey. Also identifying if there's key areas that we need to focus on, then people and organizational development can then look at it, and they can focus in those particular areas. And then the last one, which is something that I know that we've talked about within these meetings, is actually around the promotion and the communication of lessons learned, and promoting them not just within the organisation, but with this. I've actually been working with a membership association called the IT Service Management Forum, and with that we've developed a sector spotlight. We had the first sector spotlight back in April, where we promoted DHCW in there with the promotion of the Welsh Nursing Care Record Service and the lessons that they've learned from that programme. But we've brought it in along across healthcare. So we had NHS England there, we had NHS Scotland there. We also had private sector organisations coming in and discussing exactly what they're going to be doing, working with health. In the March meeting, we did a bit of a reflections exercise, and this has sort of helped to drive a forward work plan for the IRLG going forward. It's essentially a SWOT analysis, and there are a lot of areas where we felt we do need improvement. So sort of the May meeting, we're going to be going through some of this. June meeting, we'll be going through some of these to actually identify some of the further improvements. And then the last two sections of the report is the forward work plan for 2023-24. And what this will allow us to do is provide a little bit more focus back into this committee, so that you can see some of the areas that we're looking at and then work on supporting us with that. And we can then still provide that assurance that we've always tried to do throughout these meetings. And then the last bit, and I'll probably bring Darren in onto this one, is around the duty of candour, and how the duty of candour, we're going to have to be looking at elements of the instant review process to support our role within that particular duty. That's everything from me.
Fantastic, Keith. That was a really excellent report, and dangerously so, because now I've got a few questions. I see David Selway's got his hand up, and let's take those questions and then loop Darren in on the duty of candour if we can do it that way. David, would you like to ask your question?
Thanks, Rowan. Thanks, Keith. Thanks really for bringing to life what you've been doing with some real examples of things that we've done and the improvements we make. That's a much better story than just looking at the numbers. The question I had was, I think you alluded to it in the paper and in the commentary you gave around the increase between last year and this year. And I think you're suggesting that's down to the framework that we've introduced, which is making it easier to spot. Is that the case, or have I read too much into it?
Yeah, no, that's the case. So we put the framework in place towards the end of this financial year, last financial year, and because we had the information available for the reviews that we've been running throughout the last year, we were able to identify the contributory factors sooner. Retrospectively, I then just ran back through some of the reports that we'd gone through, just to provide a sort of high level comparison. One of the things that we're going to be doing going forward is obviously those numbers are going to change, and as we put more improvements in place, what we're able to then do is go, okay, we've got a reduction within the active failures, or we've actually had an increase around the data. But we'll then be able to go, we've had the increase in the data, but also we've had the opportunity to put an improvement in place, and we can then monitor that effectiveness.
Great, thanks for the clarification, Keith.
That's excellent. Chris, I know I can see your hand up as well, so would you like to come in?
Thanks, Rowan. Yeah, it was just say really helpful reports. The 6 themes for improvement particularly helpful. So thanks to Keith and Michelle, because I think they've done a lot of work on this over the last 2 years or so. But we're going into year 3, which is about embedding a culture of learning. So I guess the question or the challenge for us as a committee and for the group, how do we know when that culture has been embedded?
I think part of embedding that culture, and I was talking to Paul Evans earlier today around the duty of quality. And so the duty of quality, there's elements within that which apply to the incident review and learning group. And it's more around quality improvement. And that's really where we'll start to see that embedding of the change in the culture. And I think within DHCW, it would also be that we would be able to see that sort of, I want to say on a day-to-day basis, as language changes from into a more learning approach or a learned approach, and the fact that we could potentially have more lessons learned coming in to in through the incident review learning group.
So that's almost a flywheel approach, a flywheel effect. You know, the fact that we're adapting, we'll be doing more of it. I like that thought, Keith. Michelle, do you want to add or ask a question or add something?
Thank you, Rowan. I was just going to add a bit, and then Keith kind of picked it up toward the end there. I think it's part of it for us is about raising the profile of the group itself, which is something that we're doing. We've got some additional members who've joined the group. We've got specific points of kind of organisational escalation now going up to our management board. So where we've got issues that we particularly want to focus or draw the attention to the management team, we've added those into the performance reporting cycle, really. So we've got that joined upness. And I'm with Keith and with your comment there. I think it is about we've started, so we had a very strong focus, and we discussed it in this group on the more technical incidents. Those are the things we understand. We can articulate those. We actually, service management colleagues report them really well. We have more of a debate about those actually now in terms of the wider learning actually, and we're lifting up more, perhaps out of some of the very technical detail, which to be fair was very well covered generally by Sam and his team anyway. So it wasn't as if we had to particularly go there, but it's the wider learning, and increasingly Keith and I will be working with the group then to look at other areas of the organisation, as we said. So hopefully you'll see some of that coming through to this committee as the year progresses.
So that's great, and I know we've got a good discussion going here, and was a couple of things that I just wanted to kind of try and call out explicitly. One is, what, Keith, from your point of view, what types of characteristics does the Yorkshire framework allow us to see more readily than perhaps how we were doing it before? So what are the advantages of the framework as you've experienced?
So the framework itself was more focused into a clinical background, and it was developed by clinicians for that purpose of identifying the common contributory factors. Adapting that to a digital organization actually works quite well. And so where I find that this works is that it's not necessarily about the technology. It's about the people, it's about the processes, it's about it's across the organization. So it could be at team level, directorate level, organizational level, or even at a national level where you've got national policies coming in, which may contradict, or it may cause issues within an organization. And so the way that the framework is set out, it's effectively questions that reviewers can ask to be able to unpick that. And I think that's where why I've sort of pushed this route, because it does mean that we can then do the analysis. And if we need to put a case forward to change an organisational policy, we have that evidence base to be able to do that.
So I think that's really good. And the thing I would say as I listen to that answer is it feels like there's a real sense of empowerment across the group that things can be changed to drive a better outcome. So I think that talks to the maturity of the culture in the organization. So that, you know, that I think is excellent. The other point I was wondering was you talked about the spotlight that you did, bringing in other organizations. Was there any follow-up done by that audience to find out how that was received as a way of communicating?
So I have regular catch-ups with ITSMF. Service Management Department are members of that association, and I was talking to them and basically trying to gauge the feedback. They had 95 people sign up for it. They had an attendance rate virtually of at least 75 people. The feedback that they have been getting has been really, really good. And what they've done is they're sort of in some ways changing the way that they operate to focus more on individual sectors. So now they're looking at a sector spotlight around major incident management, but it's focusing primarily within the education sector. Other sectors that they're looking at central government and also about the finance sector. But the way that they're running these spotlights is that it's open to members and non-members, and anybody can come along to them. So it's although this was the first one, it's likely that it's just going to keep on ballooning. And one of the other things that I was talking to them about is actually service management as an entity. It's cross industry. So being able to talk healthcare to service management professionals should really be easy, but we found that it was very, very difficult to get a way in, and this was a way in. And so what we can then do is, and I think what they're looking at is making this almost a community of practice. So you've got a healthcare community of practice that, irrespective of the subject matter, you could be talking about incident management or you could be talking about performance management. There will always be an interest that you can talk health to health. And I think that's where they wanted to go.
So that's fantastic. And so I'm also keen that not only brilliant that we're looking out and learning from other organizations with similar and sharing our learning, and also then driving it through the organization and you know, how are we doing that and sharing those benefits across DHCW?
So and this is for this year's approach, and I'm working with people in organizational development to actually work out how best to do that. And I think rather than say anything else, it's a work in progress.
Excellent, you're learning.
Yes.
Part of being a learning organisation. And thank you for that, Keith, and thank you for sharing. Before we close that matter out, Darren, I think we were going to just touch on the duty of candour.
Just briefly, Chair, then just to give a little bit of context, this came into in being from the 1st of April 2023. It's come from the Health and Social Care Quality and Engagement Wales Act of 2020. It just places a duty on organisations such as ourselves to be open and honest with service users receiving care and treatment. So it very much falls within that learning aspect and that consideration. The duty is slightly different for us because we haven't got hands-on relationship with patients, but we do. Part of the prerequisite of that is a great deal of cooperation with our service users, in effect, our service users being health boards, trusts, who are using our products and services, to understand if what we have done may have contributed to an unexpected or unintended harm or death of an individual or patient, so the bar is set relatively severe, let's just say, but our obligation is to make sure that we do the learning, but also that we have a very robust communication process to understand if any harm has resulted in part of our service delivery. So it's incumbent on us to do a lot of work with our health boards and trusts, because the duty may actually be engaged by the health boards because they are the treating organisations, and we have a big and we need to understand then our responsibilities to actually contribute to that analysis and that particular a sort of learning event that comes from the back of it. So we are captured by it, even as a special health authority under our circumstances.
And that's understood. And how are there any new processes that we need to put in place? How ready are we for that? Is the obvious question that arises from that.
There's been a bit of an information campaign. In fact, our intranet page has a full set of pages for staff. In fact, I was in the staff conference talking about the duty of candour as well, just introducing some of those elements, and our incident reporting procedures incorporate some of that duty of candour responsibility as well. We've also been working actually with Welsh Government to a certain extent to understand our responsibilities in that area, because like I say, it's not the same as a health board or a trust or those NHS services that are delivering hands-on care to the patient.
Okay, are there any questions on that? I think I've got one action just to generally ask the team to review their assurance reports, just to see whether there's anything that needs to be adapted, just to reflect that we've covered off our obligations. Rydian, yes.
Just an observation, Chair. I'd just like to thank Michelle and Keith for keeping a tight rein on this. It's very important that we have organisational memory for issues that happen, because there's always the danger to repeat them. And although the NHS, the wider NHS, always talks about it being a learning organisation, we have repetitions of harm due to poor care. Our job is to make sure that there isn't harm related to technical oversight or mistakes, and this is a key part of that process. So I'd just like to say thank you to those two individuals.
Yeah, I think very, very timely to record that there, Rydian, particularly as because we're digital. You know, a clinician is one person, right? Digital systems flow across the system. If there was a cause for harm, the impact could be on a lot more people very much quicker. Helen, did I see your hand up?
Yeah, thank you for allowing me to contribute as an observer today. So I just want to say it was really great to read the report, Keith, and to hear the way you're describing it. And for me, when we set up the organisation, that being a listening and learning organisation was absolutely at the centre of who we want to be as an organisation. And the learning group and the process that underpins the work that's done there is kind of the anchor of that, I think. So unless we're doing this work that you've described, and that we're not able to learn the lessons away. So actually seeing the detail that's in there, but also the process and how those checks and balances have now improved our wider change processes, for example, I think it's just really helpful. I just want to say thank you. Really, it was it was great to listen to and great to read, and gives me a lot of assurance as the chief exec. So thank you.
Thank you.
Helen, you'll be allowed back in the future. So I'm going to move on now to our assurance report section. I know we're a little late, but maybe we'll see what we can do. Darren, can you take us through the IG assurance report, please? Information Governance Assurance Report.
Sorry, it would help if I take myself off mute. Thank you, Rowan. So this is the quarterly report that we provide. There are a number of elements in there for note. We've got the usual information around our compliance around freedom of information, any elements of incident reporting, those type of things. There's some aspects that are actually in next part of the agenda for discussion around the Wales Code for sharing personal information, etc. So I won't go over those particularly. We are we are continuing the good work around some of the framework elements that we describe as well within the report. We've continued the work in those areas. So I think, in short, this report actually defines that we are maintaining our assurance, maintaining our activity around aspects like freedom of information. We have seen a slight increase in FOI requests. That's normal course of business. That can happen. It can depend what actually happens either within our own organisation or part of just an escalated element around general NHS services. But we've coped with those quite admirably from an operational perspective. So I wasn't going to go into anything in detail unless there's any questions that the committee have on those particular elements.
David, can I ask you to come in at this point?
Thanks, Rowan. Thanks, Darren. Thanks for the report and the summary. I did read with interest the work that we're doing on the National Information Governance Framework and the observation, I think picked up by Audit Wales, if I remember correctly, around the DHCW role and responsibilities lack some clarity. Could you just speak briefly to what areas clarity is required? It also talks about needing formal agreement, and I was puzzled as to who we need to get it agreed with. So could you elaborate on those 2 points, please, Darren?
Yeah. So I think it's fair to say, David, that in terms of our own role and responsibility in previous iterations of this organisation, we've tried to do the correct thing and gather up certain elements where assurance is required around the information governance aspects. So things where organisations need to measure themselves, or we need an element of compliance that holistically helps all of that information sharing agenda. So information does not just get shared from a technical perspective. There's a lot of governance arrangements that need to come in to make sure that both organisations or multiple organisations are assured that that information, that very sensitive information, is safe when that happens. So in terms of those framework elements, we have taken on the responsibility of forming those. So part of the decision making is our accountability for those and our formal responsibility for those framework aspects. And that is through dialogue with Welsh Government to actually understand what our formal responsibilities are for those. Like I say, we've recognised those things because they are component parts to really important embedding and foundation work for the technical things that we want to do and the sharing elements that we want to do across health and social care. So we've recognised those as part of those elements. But what we're pursuing is that formal that formality of being recognised that DHCW has ultimate responsibility for the performance and the management, and of course the continuation of those elements that are defined within the framework.
Okay, thank Darren. And if I've understood you correctly, the formal approval is with Welsh Government. Is that correct?
To a certain extent, we haven't. It's not necessarily defined within a policy as such, and that policy, that policy, and that's part of the engagement discussion that we're having with Welsh Government is formulating that policy, so it provides named individual organisations with certain responsibilities, and that's the important thing, is those named important. It's defined within that. It's not defined explicitly within our functions. It is almost part of that high level function within that kind of technological and IT and system and service responsibility that we have, but it's the definition's quite high level.
Okay, thanks, Darren, and thanks for taking the initiative and trying to put in place something where there's ambiguity. So well done on what we've done so far. Let's keep an eye on it going forward. Thank you.
Yes, well done, Darren. And it's a bit like cyber, information governance at some level is everyone's job, just to be aware of what the requirements and responsibilities are. I know Ridian will say, sharing of information in the appropriate ways leads to better healthcare, so it's really important. We've also got to, make sure that everyone's information is used appropriately in the way that they expected it to be used. So, thank you very much for that report. and I look forward to picking up on some of the other aspects of it later in the meeting. Paul, can I ask you, Paul Evans, to come and present the Informatics Assurance Report, please?
Chair, Paul isn't here, so I'm going to take you
Sorry.
through this.
Excellent, we're in safe hands. Mr. Hurl.
Well, safe hands indeed, right. Cold hands actually at the moment in the front room here in Cardiff. Right, so colleagues, I'm asking for this paper to be noted. Colleagues will be familiar with the Wales Informatics Assurance process. Thanks to Paul for putting this paper together with Lydia, and we wish him luck with the task that he's got in hand at the moment. The Welsh Informatics Assurance Group have been busy. There's 20 work streams that they've been going through, and this report relates to January, February and March of this current calendar year. The salient point really is you will note the tables in 3.1 and the comment in 4.1, which was the completion of the retrospective assurance relating to all the good work that we did for the citizens of Wales relating to COVID. So it's good that actually they got it right, and we've now assured it that they got it right. So that was good. And you will see that there's some work going on regarding the DSPP private beta. That was the section in red. And we anticipate that by the next round of presentation, we will have completed that. I would be pleased if you could note the report.
Thank you, Ridian. Anyone, any comments before we note that report? David, you've got a hand up.
Yeah, thanks, Ridian. Thanks for flagging up the retrospective approval for DSPP. I seem to remember we were doing that at the last DGNS meeting, which must be 3 months ago. Is retrospective approval, does it take that long, or is this just been a little bit slow?
David, you're quite right to point that out. There are a number of changes to the programme, and it's, let's use the word agile in this case. And when there's a change, of course, there's another thing to approve.
Okay.
So no, they don't all take 3 months. There are some ones that we have to deal with urgently, and others that come through the door a little bit later.
Okay, thanks for the clarification.
Thank you, David. Good question, and thank you, Ridian. And I'm just going to share. I think it's great that we've been able to assure the COVID work, and also reflect on the fact that we had the WASPI framework allowed us to do a lot of things in COVID with a high degree of confidence that we had the IG measures under place as well. So thank you for that, Ridian, and I'll let Paul know you did an excellent job on that for him. So moving on to our next report, and that's the Information Services Assurance Report. Andy Warburton, are you ready to present the report, please?
Yes, thank you, Chair. I'm Andy Warburton. I'm the
Andy.
Head of Information and Health Records
Fabulous.
Programmes, here to present, as Rowan says, the Information Services Assurance Report, today on behalf of Rachel Powell, who is on holiday. I'd like to provide a brief overview on specific items for noting by the committee, as laid out in the tabled report, circulated report. One of the new milestones for information services for this new year is to develop an information and analytics strategy for DHCW. This is work has started, and we've got sort of a drafted version at the moment, but it will be incorporating some of the items that have come up at this committee previously, which is around the publication of the official stats as a body. So we're working through that at the moment. Other items I'd like to bring to the attention are the service management work that we continue to engage with our service management colleagues on. Due to the the value of the data that was provided by the department during COVID. We're working with the service management portfolio to try and bring in a new category, which is outside of that which currently exists around the clinical or admin standard, which the latter is describing most of the information services in that portfolio. But we want to bring in one that's around sort of information critical, something around that. It's a change in direction from that has been in the past, because this data is used for ongoing services to make decisions around and strategic work. So that is still in hand, and our team is engaged with our colleagues in service management on that. Switching service. We had the audit report, which came before this committee previously, with the recommendations within it. These have now been split, as has previously been reported, into 3 categories, primarily because the mitigation for each was a separate team or a different team having to work on that. So the 3 that we now have is around, the first one is around the resilience of the current service. The second one is the shortcomings within the existing service to develop it further. And the third one is a succession plan for that service, which we have discussed as around the NDR. The short-term approach is to tolerate the first 2 of those risks, as there is a level of mitigation already in place. We're still working and engaging with the NDR programme to get the succession plan, I won't say replacement because it's a succession plan, for the switching service within a plan of theirs that we can then look towards to migrate the services over, but that's still work in progress. We have, as you're very aware, been successful with becoming a trusted third party with accreditation through the Digital Economy Act with ONS. This is a 5-year duration, but we have to undergo annually an opportunity, I would call it, to mature our status within that act, and we have been preparing, and we submitted on the 21st of April our submissions back to them. We're now in the period that they are reviewing that submission, and I think there's been 1 question so far, so that's not bad given that we're sort of halfway through that now, of clarification requested by them. But we should know towards the end of this month where we are with that. So fingers crossed we can move ourselves up another level of maturity. The draft governance framework around the assurance of Power BI was submitted to the management board. I took away a couple of amendments to that document, which has been redrafted. We're just waiting now for approval of that by Rachel when she comes back from leave. So it will then go before the management board once again, hopefully for to mitigate the risk that is currently on Datix around that. That is the report. I'm happy to take any questions if there are any from the committee.
Thank you very much, Andrew. And you know well enough this committee, there's always going to be a question or 2.
Oh, absolutely.
David, any question?
Yes, perhaps I'll wait a second or 2 just to give somebody else a chance to get in first. But and Andrew, thanks for the update. We've previously done a deep dive on the switching service, so I welcome the breaking that risk down into 3, which gives more manageable. So for me, that's a positive. The one thing I didn't quite get my head around fully was on the second risk. We have a statement in there that says something like respond to required developments, which was a little bit, what does that mean? So could you expand on what that is and whether there's some restriction on what we can do in that space while we're sort of waiting for the NDR solution to come along?
Yeah, certainly, David. The meaning behind that is primarily that the software is quite old now, that it's been developed in, and it doesn't lend itself to any of the complex requests that we may get through from Welsh Government to change some of that data, going primarily through to Swansea University on the Sale appliance. But it hasn't caused us any difficulties so far, touch wood. But we've kind of got our eye on the future to look forward, as part of our R&I role going forwards and passing more and more complex data through to Swansea University. Noting that is a risk at the moment, should that be asked of us, but at present it hasn't caused us any difficulties there. So it's really just a cover in case that request comes through, but we're okay at the moment.
Right, good to hear. Thank you.
And Andrew, I think my question really on the switching service is, obviously it's a known risk, and we are tolerating it, in part because we want to provide good value for money. We don't want to buy something which perhaps we won't need when the NDR comes through. How do you have any sense of any sort of timeline for how long we can tolerate it, given that it is an older system, the skills to develop it, etc., are becoming rarer, and what might happen going forward? Are you generally comfortable that we can maintain our reporting requirement?
Thank you, Rowan. Yes, I would say with some element of confidence that we do have some workarounds that are manageable in the departmental business continuity plans, and we also have the first of those new 3 risks, which is being worked on by the data center services team to make the resilience more robust. So Ken Leake who was paramount in creating the switching service way back, has a cunning plan to be able to provide additional resilience in lieu of that which will be the successor to the switching service. So I think that there's really 2 aspects to it. There's what I would term keeping the train on the tracks, which is I think what you're referring to in your question, Rowan. And I would say it, of all the services, it's pretty robust and solid. Should it go wrong, there are various elements that we can use to recover it. And while it's down, if it's down, we can do manual workarounds. That's not sustainable in the long term, but clearly that is why we have this additional resilience work going on in place. And then there's the next aspect, which is around, as David touched on, the capabilities going forwards to develop our services to a more complex and changing requirements going forwards, which is, in a sense, where we look to the NDR as the replacement for that. So I think, hence, the reasons for splitting the original audit recommendation into 3, because they're addressed by different answers, basically. So I think we're hoping that the NDR program we can work with and engage. That has started. I just hasten to add they're looking at some priority data sets to work on first, one of which clearly is GP data, but that's another battle in itself, challenge to all. But no, I think we are assured that whilst it's not ideal, the toleration is acceptable.
Well, that sounds like that's within the art of the possible. So we can maintain our obligations, and I think I know David is very keen, and it's in our IMTP. We are looking to build on value from data, and it's going to be very important that we get some progress this year that takes us into new areas. So I think that's a good report, which I think we can note. So thank you for that, Andrew.
Could I just follow up that there are other ways of acquiring data that we are working with and developing further to try and take some of that reliance off the switching service. So there are other ways of doing it, which we are actively rolling out. So that is reducing the risk around that as well.
Fantastic. Sounds like all ways are being considered. Thank you for that, Andrew. Ridian, I know you're bringing forward the first of the research and innovation strategy assurance reports, I believe, in Rachel's absence. So,
okay, yes, thank you very much. Committee be aware that the RNI strategy went to the SHA board and was approved last October, and there were some things that needed to be done, and I'm grateful to Rachel for preparing the paper, and I can see she's got her headphones on, so she's primed and ready to take us through this paper.
Oh, good.
Thank you. So hi all, I'm Rachel Gem and I'm Head of Research and Innovation, and I'm here to present on behalf of Rachel Powell. So as was mentioned, the Research and Innovation Strategy was published back in October, and that was really in line with the requirements of the National Frameworks for Health and Care Research, and also linking in then to the innovation strategy that's just been published. And this was presented then to this group on the 3rd of November. And what was particularly important is around that strategic aim to improve the quality and impact of the research and innovation activities, and also the resources and the processes that we've got in place to support those activities within this organisation, and also the work that we're doing in partnership. So at the last committee, 3 actions were flagged and then agreed. And this was looking around more substantive and resilient RNI resources, around the governance and assurance processes, and then about improved engagement, so how we can actually market and communicate the work that we're doing. And one of the suggestions was with an annual report that we've been working on, and we're in the process of finalising the draft of that. So the main thing that I wanted to bring to your attention was around the governance structure. So we have been working to develop a more robust, accountable and open governance structure. And this has been through SHA boards and approved on in March. And this is really to give that approval structure for projects and also activities. So as part of this, we have set up a new operational and engagement group, and we had the first meeting of that today, which followed on from the original Research Innovation Working Group, which helped to develop the strategy. And we're also in the process of setting up a new Research Innovation Board. So the process will follow through the group and then the board, and then up to the executive group and through this committee. So what we're looking to do is to review each project and activity on an individual basis, and we've developed an impact assessment of those projects and risk assessment so that we can look in terms of information governance, potential reputational risk, financial implications, capacity capabilities, etc. So we are really looking to give that governance around those projects so that we can be assured of the quality and the potential impact that they're going to have. In addition to this, we've been working with national groups, so helping towards the research and development framework that's being developed by Health and Care Research Wales. We're being represented within the Bevan Commission, particularly on the Fellowship Steering Group, and we're also part of the All Wales NHS Innovation Leads Group. So we're helping to develop these key partnerships and groups so that we can ensure that effective engagement and to help identify particularly priority areas that we need to take forward. So the other things that we've been looking at is around being able to monitor the project. So we've got a project log that is available, and we're looking to monitor projects on an ongoing basis to make sure that they're meeting the quality criteria and that they're being conducted to time and target. Linking to this then is obviously our performance management and the delivery of our activities against the IMTP and other targets. And so we now have the monthly report out process in operation. The final thing just to bring to your attention is that we're working to look at a robust costing mechanism process for data requests. We're getting more and more data requests coming through in relation to research and innovation, and we want to make sure that we have got an understanding of our contractual obligations and then how those data is going to be used and the impact that that might have on healthcare and on policy. So if there's any questions, I'm happy to take them.
Thank you, Rachel. That was great summary. Thank you, Ridian, as well. I'm sure David has his hand up already. Are there any other questions before we let David ask his question? In case David.
I did wait a couple of seconds, but nobody got in there first. Rachel, good to meet you. Thanks for the report. Really pleased to see that we're reaching out to other organisations to collaborate with. I note all the good work you've done around governance, which is really great. The one thing I would say, picking up on the point you made about monitoring projects, this type of innovation, data innovation, it really helps if you sort of have a gated process with some checklists at each stage of the project, with the view that you don't get to continue the project unless you satisfactorily pass the gate. I shared what I've done previously in organisations I've worked with Rachel previously. Happy to share that with you if you want, if that would be of value, because I think what it does is drive up the success rate of projects. So what it does is basically flag up at an earlier stage that something isn't going to work for some reason or other, or isn't going to deliver any value. So I'd commend that. The bit I really wanted to ask about was, you touched on it, which was the more substantive and resilient RI resource, which frankly I've been banging the drum for a while that we need to do that. So it's something that I'm pleased to hear. But have we actually quantified yet what it is we think we need in Rachel's team with regard to stepping up our ability to do more of this good stuff and drive the value from data? That's one of our strategic missions.
Yes, so thank you, David, and it'd be really useful if you could share that information. So to your first point, I think what we'll be looking to do is to have that evaluation framework with stop-go markers, but obviously we'll need to tailor it then on an individual project and activity basis. In regards to sort of the resourcing capacity, we are in discussions with Welsh Government and with Health and Care Research Wales about potential funding for expanding the team. So that is something that's in consideration. So hopefully at the next committee we'll have a stronger answer to you. So it's a work in progress.
Okay, cool.
Can I just say it's great having lots of people called Rachel in your team, because you can just ask Rachel to do it. Rachel, when just remind the committee when you arrived.
So in January this year.
So we've got to give her a little bit of time, David, to get her feet under the desk and determine how she's going to lead this element of the programme for us.
No, she's made great progress, Ridian. I was aware when she joined, and I was really pleased to see what we've done in such a short space of time. And as is usual, I'm impatient, so I'm keen to help and encourage wherever possible.
Yeah, I think David's learned his impatience from me, and Rachel, excellent start, and I'm sure you have Ridian's job by the end of the year. I did have one comment, which I read the report and I thought was excellent. I'm just thinking about projects coming in from external partners. I really like the process flow chart and the governance. The piece that parties aren't always able to control and fit within that nice sort of regular meeting is if projects are grant funded and there are calls going along. So, an external party makes a request to us, and they may be applying for £1.5 million grant and offering to, seeing us as taking a few £100,000 of that, for example. I didn't see how the funding, or how we could flex perhaps into the fund, to be able to meet those funding timescales. And it's a not for now thing, but perhaps could I sort of challenge you or ask you to kind of go away and explore how that might work? and just monitor that to see how frequently that's something that comes up, because I think just getting that into those governance arrangements would be helpful. Yeah.
Yes, of course, that's something we can look at. And I think it's always the case, isn't it, when you're looking to put a robust structure in place, that the frequency of the meetings can be an issue. And we've set them in this manner as sort of a testing mechanism. But you're completely right, especially with funding bids, there is that urgency around them. So we may need to have a secondary pathway.
Excellent. Yeah, it's just a matter of being a bit flexible, but that was the thing that occurred to me. So with that in mind, I think we've reached our well, are there any other questions comments before I invite us? Okay, I think we can take our comfort break. We're a couple of minutes late, but if we could return back at 20 to 3, and David Sheard will lead us through the digital programme overview update. Thank you very much, everyone. See you in 15 minutes. Welcome back, everyone. And we're now moving up a gear again. So David Sheard, I'm going to invite you to take us through the digital programmes report. And I think there's quite a lot going on, as there always is. So thank you, David. Please begin.
Thank you, Chair. You're right, there is a lot going on, as always. So I'll start off by saying that the report as it appears for you now is the position as of the end of March. So this is as was presented to the Management Board in April, and then comes up here. So there are a couple of things that have changed since then, and I'll pick those up further down in my narrative. So sorry, can people see me? No? All right.
Oh, I can see you.
I can see you.
Yes.
Well,
that's a lovely maroon jumper you're wearing, David. That's how much I can see you.
I think you're probably in the unlucky half of the audience then, Rowan. Let me just turn my camera off and on and see if that helps people. Hold on. Is that any better?
Yeah.
Ah, wow. Right. So let's get into the heart of the report. So I'll talk about the projects and programs that are red or have had a status change. So the first one is WEDS, which is the Welsh Emergency Department System, which has been red for a while now, and we've spoken about this a couple of times. The principal change here since we last spoke is that we have completed a strategic review using an external company of the program, and the paper coming out of that, the presentation coming out of that, has been circulated to our directors, but also to the WEDS National Project Board in late April. Within that report, there was a question that needed to be answered, which was whether we could use the WEDS contractual framework but change the infrastructure such that it was locally hosted within a health board rather than being nationally hosted within the National Data Centre. This was to get around some of the problems that we've spoken about previously, whereby it's a legacy application that's being presented as a thin app client, but not being presented particularly successfully. So the Swansea Bay are the first health board. They are the only health board live with any part of WEDS. So that proposal has also, that review has gone to Swansea as well. We await a commercial proposal now from the supplier on the basis of hosting locally rather than hosting nationally. We then need to get into a decision-making process about with Swansea as the immediately impacted party, and then depending on Swansea's position with the rest of Wales. I'm going to move down to intensive care, WICIS. So there has been some movement since the report was written, but we remain red here. Our biggest single issue has been around the medications module within WCIS. That is called the drug therapy module within the system, and we haven't quite got an agreed way forward on medications, but I think we're very close to that. We're certainly a lot nearer than we were when this report was written. Also to note, we've got a new national clinical lead in place on the project as well, which is helping reset some of the governance and the clinical strategy groups, etc. We still need to work on the project finances as we work through the commercial model, because we need to reflect the impact of the revised timelines within those financial models. Right, I'll move on to link pathology. So as is stated in the report, the revised plan from the supplier was not accepted by the project board, and contractual negotiations and planning since that point have continued. And then finally, I was going to move on to cancer. So you'll note that the cancer program has been downgraded to amber. So we were green following November's go live. So it's been downgraded to amber. Firstly, there have been some ongoing operational issues that have persisted really since the go live in November, but also the estimated development timetable for some of the phase 2 elements, palliative care, for example, have extended. So as we stand at the moment, here in May, there's an ongoing reprioritization process happening. It's been led by ourselves in DHCW and by the lead clinician in within Velindre. The health boards have been consulted, but they're happy for the project team and Velindre to take the lead in terms of that prioritization. Depending on the outcome of that, the forward look really on cancer is that we may end up as red. So in terms of the written report, there were just another couple of things that I was going to add in terms of things that have happened subsequent to it. So primarily around governance, so around the Welsh Nursing Care Record, WNCR, we've had a change in SRO since the report was written. So the SRO was a lady called Claire Bevan, who I think you've met, and that has changed to be Sian Thomas. Sian is a consultant nurse from Aneurin Bevan, and she's also going to be the SRO, or already is the SRO for Digital Maternity Cymru. The other point to note on WNCR is that the scope has shifted. So in effect, we've delivered a lot of functionality for adult patients so far, and as of the 1st of April, that switched to pediatrics. So in effect, the adult forms are now business as usual, and there are SLAs being set up and agreed to cover that side of the service. And as a project, they've moved on to pediatrics. And then the final one was to do with Test, Trace, Protect. It's another governance change. So Sianeth Rees is no longer the SRO there, and it's expected to move to Claire Williams as the national lead. And I'll pause there.
Thank you, David, for taking us through that. I can see Rydian has beat David to get his hand up. So well done, Rydian. Can I ask you to make a comment or ask a question, please?
Yeah, thank you, Chair. I've been practicing at the break, making sure that I can get in first. Thank you, David. A couple of things I just wanted to go. One is probably just to explain the purpose of the arrow going down in the Welsh Intensive Care Information System when it's red already. And as far as I'm aware, it's been red already. I presume that's a typo. Just wanted to reassure the board that I've been involved with yet another Rachel in terms of that programme, and had a little bit of hands-on executive helping and some engagement with the wider community. And I feel confident that we're in a much better position than we were at the beginning of the quarter. And the second point would be related to the cancer programme there, David, in terms of the expected completion timeline. Remind me, my thinking was that was when the funding runs out rather than when the programme is completed, because as colleagues will know, there's a never-ending source of work to do for the cancer community regarding the software. Thanks, David.
So yeah, the funding runs out on cancer 31st of March this financial year. And going back to, sorry, the arrow on WCIS, I'm going to, I believe the last time we presented to this committee, we weren't red. You, as a member of the management board, you see this every month as opposed to this committee's every quarter.
So should the arrow have gone up?
No, it's been downgraded from amber to red.
It's been downgraded from amber to red.
Yeah, so the last time we were here, it was amber and it's now red. So it's going down. I'm obviously not explaining myself very well there, Rydian.
Well, I'm confused. I thought red was bad and green was good.
It is, yeah.
And amber was in the middle.
Yeah. So it's getting worse.
So then the arrow should go up, shouldn't it? Is it getting bad?
So I think I had read the down arrow as getting worse.
Yeah, I did as well.
Just because I kind of think of it as a thermometer, but yes.
Yeah.
I don't know why that is, but sort of colder is bad. Anyway, who knows?
That's that's an interesting point, Rydian. That's the way that the report is written, that if you're downgrading something, it's getting worse. It points down.
Okay.
Rightly or wrongly.
But since then, Rydian, you have had a conversation. Yeah, you've been involved with the programme, and you think that that is at least tending to improvement, or are you?
No, absolutely, it's going to improve. I'm very confident it's going to improve. Yeah. The funding point is to March 2024, is it not? Not March 2023.
Sorry,
for the cancer
funding
program?
for cancer, March 24, yeah. 31st of March 24.
Just clarify that. Okay.
Yep.
In which case, David, can I invite you to pose your question second?
Thank you. So sticking with WCIS, David, you mentioned that the finances for the project are under review because of the increase in timeline. The increases that are likely, are they likely to be covered within the project contingencies, or is there a chance that you may have to go back to Claire and ask for more money for the programme?
That's a good question, isn't it, David? That's a good question. Two Davids.
Two Davids.
Yeah, it's being dealt with by, it's a little bit sensitive, I think, David. It's being David Selway. It's being dealt with by Michelle's team. And I would be happy to give an update once those discussions have concluded.
Oh, okay, I'll hold fire on that one and return to it. Second question I had was around the NDR programme. There's been a little bit of a delay in going live with the National Data and Analytics platform. In the narrative, we talk about some resource constraints. So just wondered if you could talk a little bit more about what the issue there is, please, David.
I'm not sure what exactly the resource constraints are. I spoke to, but I can take an action and come back to you, David. I spoke to Beck, or I was messaging Beck earlier today about some of the about the benefits, which is what we were talking about in this meeting last time. So Beck has another session set up for later in in May another workshop session to try and work through some of those. But in terms of the resources itself, I'm not clear. So unless there's anyone else on the call who's better informed on that than myself, I don't know. Helen?
Shall I come in on that one?
Yeah, Helen, please.
Everyone, yeah. So I think there are ongoing discussions. So I don't think it's resource constraints within the program itself. It's resource constraints within the operational teams. So I understand that those discussions and rework dates discussions are underway at the moment in order to push it forward, because we know we've got to land this and get it up and live and starting to reap the benefits of it. So yeah.
Okay, thanks, Helen. Thanks, David.
Thank you.
Thank you, Helen. You might have a standing invitation to come to more of these meetings. That's very helpful. I would like just to kind of explore the WEDS scenario, so that move that to a locally hosted system rather than from something that's hosted in a data center. Our priority is to deliver better care, so that has to be the overarching issue. But does that have cost consequences and impact for the Welsh, the architecture that we're trying to build? What would be the ramifications for having that, planning for success? If it's a successful installation in that configuration, and that would then be the rollout model across Wales, what might be the cost consequence of that hosting architecture as it impacts the rest of our plans, would be a question that springs to mind. And I don't know, David, if you want to call on Sam for any opinion on that.
Well, shall I have a go? If Sam wants to chip in, he's very welcome. We await, first of all, we await a commercial proposal from the supplier, and that really will shine a light on that. But it's inevitable, in my view, that if we go down that route, there will be a cost to it, and that's a cost that we would have to find a funding source from. So whether that's from the health boards or health boards themselves, or from Welsh Government, it's debatable. But until we know what the cost is or would be, then it's difficult to be more specific than that. But there still remains a decision to be made about whether that is the right thing to do and whether that is the way forward.
Yes, and I suppose, David, that's you're articulating the direct cost there. I'm also thinking of the indirect cost of having something that's deployed locally many times rather than something that's hosted from the data center, and probably consistent with some of our architecture's decisions. So, Sam, have you got any thoughts on that?
Yeah, I mean, I think as a general principle, centrally hosted provision, ideally in a cloud native environment, would be the ideal architecture that we would be working towards. And I think, as part of the wider considerations that we're starting to formulate around what the national architecture looks like, what the direction of travel is for major systems, how that pertains to our cloud strategy, what our total cost of ownership models look like, etc. I think some of these considerations will start to be brought to the fore. We will be looking at roadmaps for major systems and what the best handling mechanism for those is in terms of moving them towards a more cloud native architecture. But I think some of that will have to be done on a case by case basis. I think in this particular instance, I think there are complexities, but we're going to have to tackle them, and it's tied up with the SLA funding concerns, and so there's a range of issues I think that kind of come together in some of these considerations.
Yeah, I think that's true, and I think it's very helpful just to surface those, because sometimes we see things in isolation in our digital programs, and then also need to recognise the sort of, as I call it, portfolio risk or system risk. Obviously with the primary objective is ultimately we've got to be supporting the better care piece. So sometimes you just have to take the medicine, but yeah, just something for us to reflect on.
And
the
I
other
think,
thing I did,
sorry, Rowan, if I can just add on that, I
yeah,
think what we're not seeing in some of these instances is the cost of the constraints that we are facing as a result of some of the more legacy architectures, and that's, I think, going to be crucial to determining the business case and building the case for change around some of these systems. So we've got to try and quantify that, I think.
I think that's absolutely the case, and and you know, that might be something to consider in how we think about these reports going forward. I like these reports; they're very useful. But that additional higher level information doesn't quite get captured as it's currently presented. I don't really want to talk about Link because I think we've had several briefings more recently on Link and discussed it at the last board meeting. I did, however, want to say well done. It was great to see that the Powis England cross-border activity is green. You know, I know from sort of feedback that we've had from the IM digital committee, that's been something that people have been looking forward to. So yeah, whilst it's challenging, it's also important to reflect that there are good things happening elsewhere. Any other comments on the report that people would like to bring forward? David, I'm going to thank you for that report and reflect. You know, it's a complex portfolio, and you know, financial constraints are front of mind, but it's not the only challenge in delivering these programs of work. So thank you very much for that. That's very useful. I believe the next item on the agenda is the IP policy update. If Ivan is available to join the meeting. Don't know. Hang on. Oh, sorry, Michelle, you did have a hand up and I missed you. I'm sorry.
That's okay. Thank you, Rowan. I was just going to say I'm going to take that item for Ivan, if that's okay. Ivan was hoping to join us. He's not been able to join this afternoon, but this is something that we're both working on. So hopefully I can just provide a brief update to supplement the paper that's been distributed. Is that okay? So,
that's fantastic.
Sorry, I should have said, for the benefit of the tape, as it were, Michelle Sell. So I'm the Director of Planning and Performance and the Chief Commercial Officer for Digital Health and Care Wales. So the IP policy, obviously very key in my area as in others for the organisation. So we've put a bit of an update. I am conscious this is something that we've discussed previously at this committee. Having a well documented and understood policy for our organisation is a really important development. So two things I think to note there. One is we are aware that work is happening at a national NHS Wales level, commissioned through Welsh Government, in terms of developing a direction and a policy. That hasn't got to the point of completion yet, or a point that we can adopt that in its entirety. But Ivan has reached out to Welsh Government to ensure that we've got appropriate alignment with the work that they are doing. And obviously we have a particular focus around the nature of our products and services. So I think it's likely either that will lead to a policy that we can adopt, or that we will have a sort of an offshoot or a specific policy that sits underneath that. So in order to make sure that we're continuing to move forward and make appropriate progress, we have appointed a third party to come and work with us. So a company called Inform Solutions. And what we've asked them to do is to link in with Welsh Government and that work, but also to interview other key stakeholders to get a good understanding of what we want to achieve as an organisation, and working with our stakeholders on a wider digital perspective across NHS Wales to then help us to develop, as I said, our specific policy and guidance and instructions, if you like, in terms of how we apply that policy inside of our organisation. So that work is underway. We've established a steering group. The interviews will be commencing shortly. And the plan is then to pull that together so that certainly by the next time we meet, we would hope to have that draft policy to consider at this committee.
Thank you, Michelle. That's a great summary. Any questions? If not, I've just got a couple of observations. So I think that's very pragmatic, Michelle. Firstly, I kind of, reflect on the fact the last few months you've had additional activities on. So, that wouldn't have allowed us to do any further work. And also, there's no point implementing an IP policy if it's not consistent with the rest of the NHS policy. So absolutely the pragmatic thing to do. And I really welcome, bringing in a third party to, take some external soundings and think about how this, the policy and how we operate might work to increase, opportunities for R&I and collaborations within and without of the NHS, within and without Wales. So I'm really pleased that we're in this position. So great report, and I look forward to the update at the next meeting in August. So thank you very much for that. Okay, so suddenly we're a little ahead of schedule, which is great. Darren, we had WASPI and we trailed it at the beginning of the meeting. So we have an extra 5 minutes, which is good because I think WASPI is in DHCW. So I'm really pleased to get an update. So Darren, if you can take us through the report.
Thanks, Rowan. I'd just like to say we've been joined by Marcus Sandberg and Dave Parsons. Marcus is one of the senior IG officers in the team, and Dave Parsons is our code of conduct manager. So we've been joined by two most excellent members of my team in order to help support any conversations or any questions you may have. They've been instrumental in terms of taking us forward with the Wales Accord for Sharing Personal Information, both operationally where we are now and in order to shape ourselves up into a position where we have the opportunity to take forward WASPI into its next phase, let's just say. Well, they're
both welcome, Darren, and just to say that they're both welcome, and just to say the chair did note the implied brag there on your IG team being one of the better teams in DHCW, and I'm sure all your colleagues heard it, and they'll make similar claims at subsequent meetings. So thank you very much for that, and I now look forward to the rest of the report.
Just to give you a little bit of background, the Wales Code for Sharing Personal Information has been around for some 13 years. Actually, it was born out of what was an absolutely correct intention, was to try and improve information sharing across Wales. Certainly in particular policy areas that had particular focus within government at the time, mainly around adult and child protection, some real key elements of policy drivers within government effectively. So WASPI has been around and has created some opportunities, let's just say, for putting a framework of how we actually share data in a more comprehensive way, but to document that information sharing. It doesn't resolve every single problem that comes with information sharing requirements. I think I touched on about that previously in terms of there's a framework of things that need to be achieved in order to add confidence into the system, into organisations, and to obviously our own Welsh citizens. So WASPI's been through a series of iterations. We've had it is very much a code of conduct that people can sign up to on a voluntary basis, and indeed is pan public sector. So we have health, social care, other public services, local authorities, fire, police, you name it. We've got quite a very vast array of public services that are signed up on a voluntary basis. And we've had very, very good feedback and a very good approach to how we want to use that, because it means that organisations are, let's say, talking the same language or categorising and using the same standard in order to understand what their responsibilities are when they're sharing what is, in some respects, some very sensitive information. As we know, WASPI does not help in every sense, in every eventuality, because we're still seeing aspects of information sharing failure, and it's almost on a monthly basis. It's in the news and coverage where there's some pretty horrific things that happen where there's been a failure in administrative practice where information just hasn't been shared. So the pursuit of this is to try and help create some robustness in the system, so the confidence is there, so the information is shared around some of those things that I've described. So So this is the next iteration, or this is the next, I would say, next challenge along the way in terms of our strategy is, whilst WASPI has achieved a lot, we have a pursuit within organisations that we actually subscribe to things like international standards and British standards, and they are really quite key now into those organisations, and they have a framework around them, and they have an audit framework around them, etc., etc. What we don't have in those standards is are ways of describing information sharing or information governance. In effect, they don't necessarily lend themselves cleanly to some of those standards. We have an opportunity to make WASPI into a code of conduct with the Information Commissioner's Office. That sits it very nicely within the Commissioner's role and responsibility around general data protection regulations. So the code of conduct process has been something that the ICO have been working on over the last couple of years, and we've seen that WASPI fitting into that code of conduct process quite neatly. There's a significant amount of work to do that, and it will mean that the organisations that subscribe to a code of conduct will have to then be more robust about their practices when they're using the Wales Code for Sharing Personal Information. So the paper sets out what the differences are between where we are operationally now with WASPI and what we feel derives the benefit, and what organisations would need to subscribe to for the next iteration of the phase. And some of that is about their ability to actually demonstrate an evidence and have an audit regime sat around them to make sure that they are actually using the tooling and the framework that they've subscribed to in a more comprehensive way. So we're moving forward with it because we've had some really good initial consultation exercises with public services, but because we need the Welsh Government sponsorship, this has gone through a Welsh Government consultation process as well, and Marcus and Dave have just closed the doors on that consultation process because it went through an 8 to 10 week consultation processes. And I'm pleased to say we've had over 50 responses from public services across Wales supporting the need for a framework and supporting the need to step up the framework in a way that actually drives more value out of what we're trying to achieve around that information sharing aspect. So we're on a cusp in some respects of where we could move WASPI forward into this next phase. We're collating all of those responses as part of that formal requirement with and on behalf of Welsh Government in order to relay the confidence within our public service system to actually take it to the next phase. But the paper kind of sets out some of that. So I wasn't going to go into a huge amount of detail on that. But from my perspective, I think that this is an important next phase of the Wales Code for Sharing Personal Information. As you know, if you don't invigorate things, sometimes they slip backwards. We have an opportunity working in partnership with the Information Commissioner's Office, who are absolutely supportive of this. We have the opportunity actually to be one of the first UK bodies to take this forward as an ICO code of conduct. So we're right on the opportunity of actually taking this forward. There are a number of other organisations, but they've said that we are mature enough in order to take this forward into the next phase of the code of conduct and get the ICO mark of approval, for want of a better word, and to take this forward. But what comes with that, of course, is a requirement for some resource in order to commit to some level of audit and some level of resourcing that extra element that would come as part of almost a code owner, as this described in the paper, to help measure those organisations in their compliance against WASPI. So that's kind of it. That's how the paper describes that, and the paper's there for noting. But obviously we've sought support across public services as part of that consultation process, and we're always seeking that support with Welsh Government as well, seeking the support of Welsh Government in order to take it to the next layer effectively.
A masterful summary. David Selway, question.
I have a question, but I just wanted to make some comments on what Darren said. So, Darren, we're doing some really important and great work here. I also sit on the board of a housing association that signed up to WASPI, and I've seen firsthand how some of that information helps provide the housing association provide support to those people in the community. So I'm fully behind this and will lend my support to it. Well, I have one question, but you prompted a second as well. So in the slightly unrelated to what we've been talking about, but in the appendix attached, you've got an extract from the ITP, and it talks about a national audit system being in place. I just wanted some clarification. Is that a replacement for what we refer to as NIHAS, or is it something different?
Yes, that's unrelated to this, David, but yes, that's our National Integrated Auditing System. So the IMTP has a number of items that are contained underneath the framework. So we have the Wales Code for Sharing Personal Information. NIHAS is also under that in terms of our, again, continuing the story of everything that falls under that framework description.
Cool. Okay. And then the second question, prompted by what you said, was I think you said you needed some additional resource to support the development of the code of practice. Do you have that within the team you've got, or is that additional to the team you've got?
We have a business case out with Welsh Government because it will require additional resource in order to do that, because it's, of course, the capacity is the commitment from a code owner. It would need to actually put an audit regime together and a framework around that audit, that ability to audit those organisations, which very much as part of the kind of the early draft of what we've seen in the consultation. Organisations are supportive of having done to them in terms of being able to demonstrate those things, because they can then attain a certain accreditation or certification to actually to OSPI under those circumstances. So they're very supportive of that.
Okay, good luck with the business case. Hope it comes through.
Thank you. I don't know if Dave, you wanted to add anything there, just briefly in terms of what was said.
Not particularly, Darren. I think you've articulated it very well, actually. I think the main goal for us now going forward, I guess, is going to be to pull together our executive summary of the feedback, the formal feedback that we've had, and to publish that via the Welsh Government consultation route. And I guess the next stage after that is working then, as Darren mentioned, with the Information Commissioner then to formally take the next steps forward then in both terms of the application for the Code of Conduct, but also the application to become a monitoring body. So there's two separate applications that DHW will then be leading.
That's very helpful, and I can see Helen's got her hand up. I think, you know, before I call Helen in, I just want to kind of put on the record the huge advantage that Wales has because of WASPI. You know, that enabled you to do things in the COVID pandemic with a measure of rigor that perhaps was more difficult to achieve in the rest of the UK. And I think you should be very proud of that. And I think we as an organisation should also recognise that that's you know, a very strong signal in terms of how seriously we take information governance, that we have WASPI in place. You know, I think this next stepping up of you know, perhaps working towards a code of conduct is, you know, to David's point, something I support hugely, because there's so many benefits that flow from it in terms of providing some formality and guaranteeing how people's information is shared and used for their benefit across the public services in Wales and for their general health. So I'm going to call you CEO in, but first of all, I'm going to use my small role as the chair of this committee to really commend what you've done here. It's phenomenal. Helen, would you like to say a few words?
Yeah, you've stolen all my thunder there. And that's exactly, you know, the point I was going to make, actually. The proof has been in the pudding, really, in terms of the response to the pandemic and what the WASPI arrangements and our approach, perhaps a more mature approach to how we're, you know, pan-public sector data sharing, how we do that in Wales. I think it's come to the fore there, didn't it? So this feels like the appropriate next step to continue to trailblaze in this area and actually demonstrate kind of, well, actually setting the stakes higher in terms of the code of conduct, isn't it? So I just think it's you know, it's something that I personally, and I know colleagues wholeheartedly support. So, and the team have done a great job here, actually, in terms of the engagement and the approach that's been taken right across the piece, really. So, yeah, let's hope that we get good feedback from the consultation, because that's good that we had that level of response, and that we can take that on board and drive it forward if we get the investment we need to see it through to fruition. But well done.
Thank you.
Yeah,
Cheers.
I hope so, because I think it's a foundation for delivering on the data promise, and I think there is a synergy here with the IG and also the cyber piece that Jamie leads. To have both of those things gives us the ability to support colleagues across the wider NHS and public services. So yes, I hope on this one, even in the current financial climate, that the value for money is recognised. Darren, I think you're up next on data sharing during the coronavirus report. So I may have stolen some of your thunder on this one with my previous comments, but
I believe the data promise is next. Is that
oh,
correct?
Sorry,
I
data
don't mind
promise.
doing the other way around, Chair. That's completely.
Data promise. You're very right to correct me. Thank you.
No worries. It's only because I got my my papers teed up, so to speak. So just to give another brief bit of background and summarization. So the data promise was born out of strategies and statements of intent, actually, that have been born out of Welsh Government in terms of the promise effectively is about being what I describe as trust, transparency and accountability of information sharing. And again, very similar themes, but being able to communicate that with our own Welsh residents and members of the public about how information held about those individuals across health and social care is being used currently and needs to be used in the future. So the previous policies or statements have been aware of the fact that we probably are not communicated enough to add confidence to organisations and Welsh residents about how we organise ourselves and how we share data. We do it in pockets. We don't do it as one approach. So the promise was born out about how we can describe those things. We describe the controls that we have. We describe how we engage, and we describe then some of those layers of accountability and those measures we have to guarantee to try and guarantee or to try and promise, in effect, that we are not. We've thought about these things and we're not taking too many strides forward about how we use individual citizen information. So it's gone through a series of discussions, quite a long pathway through a number of policy areas and policy leads within Welsh Government. We're at a kind of, again, another junction in terms of the data promise. We've spotlighted is there's these three component parts. One is Wales, in some respects, hasn't well described its policy intention on certain aspects where information or the ability to use information is standardized. So aspects, to give you some indication, aspects what our policy might be around opting out, individuals' opportunities to opt out, what their opportunities are around certain aspects of governance arrangements with data, those type of things. So our policy areas need some improvement. That's not within our gift in order to create that policy. That's a recognised responsibility of Welsh Government to do that. We've had recent discussions about where DHCW could help out in certain circumstances. So part of this is about how we engage with stakeholders and citizens around describing what we do. Now, describing what we do, we can describe, and like I say, we kind of hide our light slightly on what we already have as part of a robust governance process, things that we've described today, WASPI, some of those other elements as well that help to navigate the citizen into understanding, okay, well, yes, information held about me is safe and secure under those circumstances for direct care or for other purposes that we might describe within things like the National Data Resource, for instance. So that transparency element is really important, and that accountability and that trust element is very important when we want to take that forward. So the citizen and the stakeholder engagement element has been spotlighted as where DHCW could help out. Now, we don't necessarily have all of the tools in order to do that ourselves, but with conversations with our Chief Digital Officer for Wales is to understand where we could potentially assist in that process of engagement and assist in that process of sort of stakeholder discussions. The other element within that, wrapped within that frame of a description of data promise, is that organizational accountability measures, things we've discussed, where organizations can buy into parts of the framework that allow them to demonstrate that governance, that robust governance arrangement. Like we said, WASPI, aspects of our other framework, with things like an information governance toolkit, using training, using other resources that mean that if they're asked the question, how robust are you around your governance arrangements, what do you have? Some of those framework elements, of course, are pan-public sector. Some of them are isolated within certain organisations within health and social care and may have a narrowing responsibility or need to have an expanding responsibility. But again, that's kind of falls within our remit in some respects. It comes back to what David said originally, is where's our layer of accountability around some of those framework aspects. So the paper describes what we're trying to do in terms of describing those actions and those purposes. What I have at the moment is John Sweeney, who went over to Welsh Government to help to start frame that, is now back with us, and together with consultation with some of our engagement and our comms colleagues within DHCWs, describe those artifacts so that we can move forward and understand where Welsh Government has a responsibility and where we are being asked to actually respond to some of those artifacts or some of those actions that are required out of the data promise work. So that's kind of where we are. The data promise was raised as a risk because there were a number of dependencies. What we're recommending is we reframe that risk into those component parts so that it is more accurate as to where we are now following those conversations with the Welsh Government and highlighting and spotlighting some of those things that DHCW could potentially do, pending, again, any resource discussions around how we take those forward as an organisation ourselves, representing that whole health and social care and wider public service aspect. So that's kind of that's the paper in a kind of a very, very short discussion.
So that was neatly done, Darren. Thank you. And you know, I'm always welcoming when we have a big risk and we split it down, because it shows we're actually understanding the risk, and so that's always well received by me. David, you had your hand up.
I did. Thanks, Chair. Thanks, Darren. Darren, so in the report in section 4.1, you talk about resources and funding need to be established. So what you said about the resource that we've loaned to Welsh Government coming back, from an IG perspective, is that sufficient for you to execute this plan, or do you need more? There's also some dependency on comms, and I wasn't quite sure when you mentioned Welsh Government, whether it was Welsh Government taking the lead on comms or whether we're looking to use our comms team and engagement team that we've recently strengthened to do that. So those two questions, but then I also wanted to link it to the point that's going to follow on from this, which is the data sharing during COVID. I think there's potentially some opportunities to explain to the wider public the benefits that we got from that data sharing, because when we're talking about a comms campaign, leading with the benefits of it is a lot easier than just trying to sort of reassure people that their data is safe. So I think if we start the campaign with a load of these were the benefits we gained from sharing during COVID, and then the second task becomes a little bit easier, I feel.
Yes, thank you, David. So to answer your first question, this would have to be a programme of work, because DHCW isn't necessarily has the skill set fully in order to understand how that engagement and that stakeholder event type of thing that would need to be taken forward would happen. And we would need to understand who would lead some of that discussion as well. You know, we've spoken about the fact that there's been a number of different ways that this has been done over in other administrations, and it's been led either by government or been led by certain administrations. But we've spoken about it being led by the service, by those that are on the front line, effectively, those that are delivering health and social care on the front line, because they are the ones on a day-to-day basis are talking and are treating the patient. So it's about, we have discussions about who should lead part of that voice, a part of that campaign, those type of things. And Helen has spoken with Welsh Government, and we've spoken collectively about that as well. So don't get me wrong, we might have some skills within our organisation, but this is why we have to look at it. This is a programme of work, because it isn't something that you embark on lightly. It would be a programme of work that would require some robustness in all those things, that engagement, that stakeholder engagement, and that communications, that we don't necessarily have all the tools in the box to actually deliver ourselves. We would have to look wider in order to do that. And then secondly, I agree. I think we can demonstrate, and I think I said we can demonstrate where the benefit has already been massively considered. You mentioned about the COVID again in terms of WASPI. The other things that we had some pretty significant impact on were the settlement of Ukraine families, etc. So there's a huge information sharing requirement there. Again, we built into that, but we didn't necessarily highlight that from a communications, because that was around information sharing across services again. So there are a lot of things that we could demonstrate across health and social care and public services as a lead into what we want to do next. So I completely agree.
Yes, Darren, and I'm really pleased that you recognise it's not necessarily all for us to do or all in our skill set. It's an incredibly important piece of work, and you know, I think we're all aware in several initiatives where things haven't gone well, but I think there are also some really good examples of where good communication and structure in how the communication was done has yielded some really good results. So yes, and I think there are parallels between what we heard from Keith earlier on the learning. You know, on the service desk, you don't necessarily need to lead with, you know, the technical aspects of the issue, but present the information very much in a what it means for the person receiving it. So yes. So I'm going to watch this one with interest, Darren. I don't think there's any more that we can say at this point, but thank you very much for the update. That's very useful. And perhaps we can now move on to the next piece, which I jumped to ahead of schedule, which is data sharing during the coronavirus report, please.
Thank you, Rowan. I won't go over all ground. We've discussed this probably in the round, actually, in the previous two items, but this just demonstrates the fact that the spotlight in terms of where we are with Wales, in terms of some of those information sharing opportunities that we capitalised on as a result of already having these frameworks, came out in a national report, effectively, that following a kind of an inquiry or a report, that it recognised that we had the opportunity in Wales in order to prevent some of those barriers from emerging as a result of having the frameworks already in place, and that those opportunities around coronavirus were maximised, where we were having quite detailed discussions with 22 local authorities, 7 health boards, 3 trusts, and all of those public services that needed to come together and share critical information very quickly in order to respond to the pandemic, and that the agreement that was set against that. So we didn't talk about what agreements we should have. We didn't talk about how we would do it necessarily. We got into the conversation quite quickly, how we technically did that and what resources need to be lined up. So it wasn't leading the conversation. We'd already almost leveled off all of those considerations, and they didn't necessarily become a critical factor to actually moving forward to the critical work, which was getting our response to the pandemic up and running as quickly as possible, with all of those public services that needed to be involved, certainly in the test, trace and protect elements, and the test elements, where we had to have multiple agencies, multiple organizations who all had to subscribe to sharing data under a certain regime. So this report again shines a spotlight on the arrangements that that we had and that we could call upon, basically.
Very good. Does anyone have any comments or Sam, I'm going to go in reverse order because David keeps winning. So Sam, I'm going to invite you to ask a question.
Thank you, Chair. Yeah, thanks, Darren. As somebody who was very closely involved in the COVID response in England, I often reflect on how much was able to be achieved during that time and how the pace of change was really accelerated. I just wonder whether we see, as a result of the work that we did, any lasting improvement on our ability to share data. It sounds a bit like, from what you were saying, that we had most of the prerequisites in place and we were therefore able to hit the ground running. But have we seen any sustained benefits as a result of the work that was done during COVID?
That's a really good question, Sam. Really good question. From my perspective, I think relationships between our local authorities and our public services has improved. That we almost overcome some notional barriers from those organisations, that they were things that we could not do, we couldn't achieve. So we quickly proved that we could. And so that relationship element, I believe, in terms of our health and social care responsibilities, that for the first time we are now speaking on a real firm base with our social care providers about how that information can get shared under different purposes, under operational and the day-to-day capacity. So we are now, from my perspective, there's more work, more integrated work being done across those areas as a result of the things that we'd worked out through the pandemic quite quickly. So it added confidence in the system that we could capitalize on what we'd already achieved.
Thank you.
It's not everything. It won't, there's still lots, don't get me wrong, there's still lots of huge challenges in front of us. But what I think it's done is, again, it's added a layer to our foundations in some respects.
And I suppose, Sam, that the other point of this is it's the IG layer, and of course it doesn't mean that money springs forth to build the systems and software on top of it. But I think that's a good question, David.
Thanks, Ronan. Thanks again, Darren. So paper's really good, and it sort of sets out exactly what we did to basically support Welsh Government, health boards, and everybody else that was involved. The one thing I think, and this might be a question or a observation for Ridian, is what doesn't come out of the paper is all of the good work that we did, which enabled the response to the pandemic. But not seen through the eyes of the recipients, the members of the public, how they benefited from the data sharing that was going on behind the scenes. So it would be really good part of the comms campaign around the data promise if we could basically have a number of stories around what it meant for the patient in terms of our response to the pandemic. Might be a question more for Ridian, because
I'd agree, David. Okay. My observation is when patients come to clinic and they see me with a computer and I ask them things, they assume that are on the computer already. So patients don't understand that the GPs hold their information, the hospitals hold their information, WAST hold their information, Choose Pharmacy hold their information. They assume that their information is just available in the system. So the data promise has to land in a way that you thought we were doing this, we'd like to do that. and then be cognizant of the fact that there's a next step. And the next step, the real value, is collating, pseudonymized collating, and safeguarding and consuming that information. And really the data promise is about that element. And we've seen it not working well in other home nations. And there is some obvious nervousness. In fact, I was reviewing the timelines that are available online regarding Welsh Government's statement of intent from 2017, and also some of the papers that they produced regarding policies. There's some hesitancy. I think probably, David, the part of the hesitancy is the fact that there was a gap in the leadership and the governance in Welsh Government, which has now been filled by the CDO, and we can now proceed hopefully fast with discussions on how and whom is going to lead that conversation with the public.
Thanks.
So I think that's very well put, Rydian, and yeah, I think there's lots of stories that can come through to sort of help people think differently. You know, one of the challenges of having this great brand, the NHS, or NHS in Wales, is people think of it as one organisation, and it's not. And therefore, you can't share information across organisational boundaries without the governance being in place. And of course, if you come into the hospital clinic worried about some of those other things, perhaps the finer details of that information governance isn't at the top of your mind, let's say. Darren?
Yes, and furthermore, sorry, Rowan, is that of course NHS Wales doesn't exist as an entity to hold the legislative power to do that. I'm very fortunate to have Darren, because he's an expert on what some might consider a rather dry subject.
Thank you, Rydian.
Darren, would you like to explain how information governance also saves lives?
I won't go into detail. I'm conscious of time. All I was going to say is, from my perspective, I'm also very grateful for the organisation, for DHCW, the board, and the individuals who are and those who are responsible for making those decisions, and the fact that we're not constrained by where we actually try and develop these and who they're trying to develop some of these frameworks for. The planned public service aspect, some organisations might not even entertain going into that because it's not within their functions or their responsibilities. So I think it needs to be recognised that DHCW's reach is actually quite significant when it comes to these type of things, and it's not always appreciated by other individuals, not necessarily within this organisation, but other organisations that are actually dependent in some respects in terms of that reach. So we're not, our ambition, and we talk about innovation in almost a data way, but our innovation and ambition actually reaches quite a significant has quite a significant effect across all of that public service aspects, and I think that should be recognised as part of the kind of the innovation element and the sort of strategy that we're trying to have as an organisation. And I'll finish there.
David, I think Rowan might have frozen.
Yeah, I got a feeling she has. Yeah, probably something to do with her interconnection in France. Okay, so oh, you're back.
Sorry. I obviously felt myself talking to myself there. Sorry, guys. My network's a little bit unstable. What I was saying, Darren, was when I read the board papers, that was exactly what I was thinking. And as we come to the end of the meeting and we think about what things we really want to take up to the board, I think this is a very important message to land, because you can't have the data promise without these things in place, and you can't have a healthier Wales without recognising that the foundation of that is to be able to share information across the whole of the public sector in Wales to deliver those services to people where they live in life at the point that they need them. So yes, I think it's a really important step forward, and was very close papers, so thank you for that. We have reached that point in the meeting, I believe, where it's closing matters. I did ask at the top of the hour whether there was any other business, any other urgent business. So can I get confirmation there's nothing else? No? Okay, that's great. So items for the chair's highlight report to the board. I would particularly like to highlight, Chris, the excellent work from the learning report we heard from Keith. I think there's a lot to take out of that. The assurance reports, as always, were up, very good. Great to see the first report from R&I and the progress on IP. And I would like to kind of put a little information, perhaps a little bit more into the chair's report, Chris, on WASPI and the strategic sort of benefits of moving towards a code of conduct, if that's what the feedback with this general support for the benefits that were achieved in COVID, and starting to tell some of those stories, and just really, painting a picture of that pathway, that these things need to happen in order to be able to deliver higher quality services in Wales that are consistent with a healthier Wales. So I think that was sort of what I took out of today's meeting. Was there anything else that in my excitement I've forgotten?
The only thing I would add, Rowan, is we have had quite an increase in the number of risks raised during the month. So I think we need to highlight that, but also qualify that a little bit by saying that we've taken the opportunity around switching service to take one risk and make it 3. So provide a little bit of context around that. But I think it's important we sort of highlight that there have been quite a few that we've added during the months, and we've done a deep dive on one of those and had some assurance about the one that Darren spoke to earlier.
Very good point. Thank you, David. In which case, I think with that noted by Chris, the date of the next meeting is Thursday, the 3rd of August, before everyone goes on their holidays. So very good. And I'm going to give people a 14-minute comfort break now, so that we can start the private meeting at 4 o'clock your time, 5 o'clock where I am. So thank you very much for that, everyone. See you in 15 minutes, thereabouts.